That's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare and Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. It's Gil Lederman, and we have a caller, Wayne, on the line. Good morning, Wayne. Hello, Wayne. We lost him, so sorry about that. You can call back if you want. We care about you, so we didn't mean to lose you. I think you lost us, but whatever it is, you're welcome to call. Or anyone's welcome to call. Bob and Ed are at 800-321-0710. I want to talk about a man I saw this week. I treated him for lung cancer. So he had a metastatic lung cancer. It started in the lung and went up into the neck. So because it was outside the lung, in lymph nodes in the neck, in the right neck, it was metastatic. He had been on chemotherapy. It wasn't working as well as he wanted, so he came to us and asked if he could have the radiosurgery with the chemo from another hospital. And so, yes, we treated him, and then he got a PET scan over there, and he came to me, and he said, I couldn't understand what they're talking about the PET scan. They said it's all kind of messed up. So then I got the report from the PET scan, and the PET scan said very clearly everything that we treated was in complete remission. It was no longer PET uptake positive. It went from PET uptake positive to PET uptake negative with our treatment. And he's a smoker, so he has some lung disease. And actually, we might be talking about that article, the people that have more history of pneumonia and other lung symptoms have higher rates of lung cancer, probably due to smoking. So anyway, this man we met last week when he said that it's all messed up, and then we met this week, and I gave him a copy of the report, and I showed him what we treated was in remission, which is obviously good news, so it's our good news department. And then he started talking, and he said, Doc, you're different. And I said, what do you mean? He said, well, when I was going to go see the chemo guys, it took 48 days for me to see them and get started. Okay, so he had lung cancer. 48 days he counted from the time he called to make the appointment to starting chemotherapy. And I said, well, what do you mean? He said, well, I called you and you saw me the next day. He said, you're different. You care about us, and I feel that. And it was a very nice compliment, and I appreciate that. Well, anyway, he has done well. His PET scan shows no activity in the treated area. There's no new cancer, so he's in remission. He is a smoker. He's in remission, and he'll be back in a couple months for a checkup or whenever he wants. He has my cell phone number. He can call. But it was a nice compliment and good news. Complete remission for a metastatic lung cancer that we treated. And another man I saw this week with a head and neck cancer we treated 2 years ago is a man from Iran. He came at the time when many Iranians left Iran and had an advanced head and neck cancer. So what are head and neck cancers? Well, they're not really brain tumors. Head and neck cancer is a term we use for people with cancers of the throat, mouth, pharynx, airways, aerodigestive system. So he had a tonsillar cancer with neck involvement. He had first-line therapy, and it didn't work. And then he had a new nodule. He came for radiosurgery. We treated him with radiosurgery to that. And he's been in complete remission now for 2 years. He's a manager at a pizza shop. He's doing well. He's got a variety of minor symptoms and some numbness in his fingers, which is probably from the median nerve that is not being compressed when he sleeps. His physical exam is normal. PET scan is completely normal. He's in complete remission now for 2 years from head and neck cancer after radiosurgery with us. And another interesting man, 66-year-old married man with one child. He had an elevated PSA of 4.6. He had a biopsy with a Gleason 7. So PSA is the blood test. Gleason is how the cancer looks under the microscope. Gleason 7 and higher, Gleason 7, 8, 9, 10 are considered high-risk pathology. He went to one hospital. He told me this story. I never met him until this week. Very interesting man. He is a contractor. He does those fancy apartments in Manhattan where the $20 million ends up from people in Brazil and elsewhere. So he knows a lot. But he had the Gleason 7, and he saw doctors in New Jersey. And when he went there for consultation, he said he only saw the nurse. The doctor was standing in the corner, and the nurse was talking, and he didn't like it. He wanted to hear from the person who was going to treat him, not the person's nurse, and he was very concerned that the nurse was running the show. I have nothing against nurses, obviously. Nurses are great, but the patient wanted to hear from the doctor. The doctor was standing in the corner, not saying a word. And then he went elsewhere. His friends hooked him up because they heard the fanciest treatment was supposedly robotic surgery, and he had robotic surgery. Well, the problem with robotic surgery, a couple things, number one of which is for Gleason 7, robotic surgery only gives a 60% success rate, whereas our data for our unique program, which is treatment in the stereotactic frame and brachytherapy, which is a shorter course of radiation but more effective, gives a 90% success rate. So you can look at it in our prostate booklet. If you have prostate cancer or are thinking about prostate cancer or have friends with prostate cancer, you may want to look at the booklet because the data is there from major centers across the country, and you will see that if you go to the best surgeon, the results are not very good for Gleason 7. So it's not the surgeon. It has nothing to do with the surgeon. Someone said, oh, you knock on people. Well, no, I don't. But if you have a Gleason 7 cancer and you're expecting good results and you have surgery and you think robotic is the fanciest thing, you're going to be most likely sadly disappointed. And this man is sadly disappointed. So it's only been 2.5 years. His PSA is going up. After surgery for prostate cancer, the PSA should be 0.0. There should be no prostate. And it's only the prostate that makes PSA. So his PSA is going up. Luckily, even though his surgeon couldn't give him the results he wanted, the surgeon did say it's time to get radiation, and this man's going to proceed with radiation with us. We believe our results are great. I wish we saw him at the beginning, because the beginning is always the best. It's best to have the first treatment being the most successful, so you don't have to have subsequent treatments. By the way, why did his cancer come back? Well, I showed him why. We sat down with him and his wife. I showed him the pathology. I showed him the scans. So in this case, number one is Gleason 7. Surgical success rate 60%, our success rate 90%, which is 50% higher. Number two, where the surgeon cut, he left cancer behind. That's called positive margin. So if you imagine you have cancer and the surgeon cuts at a point and there's cancer up to that margin, then obviously there's cancer on the other side that's left behind. Cancer surgery, but I'm not advocating cancer surgery, but they should be a complete removal of cancer with negative margins, and that's true for breast cancer, it's true for prostate cancer, it's true for colon cancer. And we'll talk about another case later on about how leaving colon cancer resulted in calamity for a patient. So positive margins, Gleason 7, unfortunately, it was doomed to come back. It came back. He's here with us, and we are going to do everything we can to prevent it from returning. And another man with prostate cancer, this is a man 66 years old. He had surgery in 2005. At that time, he had a PSA 3.97 Gleason 6. He had surgery, and now in our data, I can tell you our data for Gleason 6, PSA 3.97, is over a 95% success rate. So the vast majority of men are cancer-free. The vast majority keep their sex life and urinary life. This man had surgery. He lost sexual function. He lost control of his urine. He's now been, since 2005, so 9 years leaking urine. So it's pretty difficult for him. No erections. And the PSA is rising. So it's a similar case. For him, it took 9 years to get to us. The other man was 2.5 years to get to us, but both had surgery. Both have recurrence of their cancer after surgery. This man lost quality of life issues, sexual and urinary function, which is devastating, obviously, for most men. We're going to treat both and do our best to get the cancer in remission this time. This is Dr. Lederman from Radiosurgery New York in Manhattan. We're at 1384 Broadway. We're a cancer treatment center. We treat patients with cancer. We treat patients who have lumps. We have a lot of people come to us with very suspicious lumps. We have many women who come to us with lumps in the breast that just are growing over the years. You do not have to be afraid. We can, if you wish, stick a little needle in without pain, give a diagnosis, stage you up. We had another woman just like this week, came in after cancer or a lump growing for 2.5 years, put a little needle in, got her staged up, found the cancer was localized, and treating her. So please don't sit home if you got a lump or something suspicious. Please don't sit home. It most likely is not going to get better by itself. Give us a call. Our office is 212-CHOICES. 212-CHOICES. For medical questions, you can call anytime you want, day or night. 212-CHOICES, which is 212-246-4237. Anyway, this is Dr. Lederman. We're going to hear just in a moment for a word from our sponsor, and then we'll be right back. Here we go.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212 Choices. 212 Choices for a fresh second opinion.